Welcome to today's episode, where we dive deep into one of the most debated health topics of our time: smoking, vaping, and how they intertwine with our lifestyles. Whether you're a smoker, a vapor, or someone curious about the impacts of these habits, this discussion will shed light on the latest trends, research, and controversies. We'll explore how e-cigarettes have taken the world by storm, their rise as a smoking cessation tool, and the health risks that have emerged. With smoking rates declining but vaping on the rise, what does this mean for our health and society? We'll look at the data, compare nicotine replacement therapies with e-cigarettes, and discuss the social and economic implications. So, grab a seat and join us as we navigate the complex landscape of smoking, vaping, and lifestyle choices, and what they mean for you and your loved ones. Stay tuned. Smoking, e-cigarettes, and lifestyle. Electronic cigarettes have become one of the hottest topics in the smoking industry. While the medical community continues to debate the safety of e-cigarettes, the public has already made their choice, taking a gamble with their health. In 2018, 6.3% of people in the UK vaped, a significant increase of 70% from 2014, according to the Office of National Statistics. Interestingly, more than half of these users started vaping as a way to quit smoking. However, recent events have raised safety concerns. Over the past year, several deaths in the United States have brought e-cigarettes under scrutiny. This has led to varying levels of restrictions in many countries, although no such proposals are currently on the table in the UK. In January 2019, a study published in the New England Journal of Medicine, NEJM, provided some of the first comparisons between nicotine replacement therapy, NRT, and e-cigarettes. The study involved 886 adult smokers from smoking cessation clinics in East Sussex, Leicester, and London. Participants were randomly assigned to receive either an e-cigarette starter pack with a recommendation to purchase additional e-liquids or a nicotine replacement therapy of their choice for 3 months. All participants received weekly behavioral support for at least 4 weeks. The study's main outcome was abstinence at 1 year. The results were telling. 18% of the e-cigarette group remained abstinent compared to 9.9% of the NRT group, a relative risk of 1.83. Notably, 80% of successful quitters in the e-cigarette group continued using e-cigarettes after a year, while only 9% of NRT users did the same. E-cigarettes were found to cause more throat and mouth irritation, 65% versus 51%, while NRT was associated with higher nausea rates, 38% versus 31%. Interestingly, the e-cigarette group reported fewer incidences of cough, although there was no significant change in wheezing or shortness of breath. The editorial accompanying the study in the NEJM highlighted several concerns. While e-cigarettes seem more effective in helping people quit smoking, their long-term safety remains uncertain. Most e-cigarette users continue vaping, unlike NRT users who tend to quit all nicotine products. The effectiveness of e-cigarettes must be balanced against potential long-term risks. Beyond safety, there are social considerations. The normalization of e-cigarette use among adults could influence younger people to start vaping. The National Institute of Health Research evaluated the study and published its findings in the BMJ. They pointed out the cost differences, noting that an e-cigarette starter pack costs $30.25, compared to $120 for 3 months of NRT. This could make e-cigarettes a more economically viable option for NHS stop-smoking services. However, the long-term costs and potential exposure risks for children should also be considered. While e-cigarettes might help more people quit smoking, the harmful effects of traditional smoking are well documented and severe, making it a complex issue to compare directly. Can you trust e-cigarettes? In 2015, a study by Public Health England claimed that e-cigarettes are 95% less harmful than traditional cigarettes. While this figure was met with optimism, it also drew criticism due to a lack of comprehensive data backing such a significant claim. Fast forward to 2019, and the narrative shifted with reports of over 2,600 cases of lung injuries and 60 deaths in the United States linked to e-cigarettes, making those initial safety assurances harder to trust. EVALI, the lung injury linked to vaping. E-cigarette or vaping-associated lung injury, known as EVALI, has become a recognized condition, A 2020 report from the Mental Health Research Authority urged clinicians to be vigilant with patients presenting respiratory symptoms who have a history of e-cigarette use within the past 30 days. This mirrors the caution exercised with traditional smoking, now extending to vaping. What happened in the USA? The surge in EVALI cases in the US prompted concerns, contrasting sharply with the situation in the UK, where reports of severe incidents have been minimal. The U.S. Centers for Disease Control and Prevention, CDC, linked 86% of these cases to vaping devices containing tetrahydrocannabinol, THC. Vitamin E acetate, often found in THC products, emerged as a primary suspect, though the exact mechanism remains unclear. In contrast, the UK's stricter e-cigarette regulations, particularly the ban on certain vitamin additives, may have helped mitigate such risks. Does vaping offer health benefits? When it comes to health improvements, the evidence remains mixed. A study in the Annals of Internal Medicine, 2017, found that e-cigarette users had significantly lower levels of toxins and carcinogens compared to traditional smokers, suggesting a safer profile. Similarly, a 2019 study from Dundee noted improved arterial function in smokers who switched to e-cigarettes, potentially lowering their cardiac risk. However, a longitudinal study in the U.S. indicated an increased risk of lung disease among e-cigarette users, although less than that of traditional smokers. The complexity of e-cigarettes are not a monolithic category. Each device can produce unique compounds that may pose health risks. A review in the New England Journal of Medicine, 2016, highlighted that vaping can generate potentially harmful substances, while a 2018 thorax study found that vaporized e-liquid chemicals might contribute to lung inflammation and the development of conditions like COPD. In conclusion, while e-cigarettes may present a less harmful alternative to traditional smoking, their safety and health benefits are still subjects of ongoing research and debate. As with any health-related decision, it's crucial to stay informed and weigh the risks and benefits carefully. E-cigarettes: a safer alternative or a gateway to smoking? While there is ongoing evidence suggesting that e-cigarettes are safer than traditional cigarettes, long-term safety data is still needed. This data will take time to accumulate, but in the meantime, it's essential to provide clear guidance to users. According to a 2019 editorial in NEJM, 2019, 380, 678, there is no ideal duration for e-cigarette use. Patients should aim to use the lowest dose that effectively curbs their cravings and establish a structured plan for reducing or stopping use altogether. Do e-cigarettes encourage youth smoking? A significant concern is whether e-cigarettes serve as a gateway to regular tobacco use, particularly among young people. Although it's not appropriate to market e-cigarettes to youth, there are fears that this demographic is crucial for businesses, leading to indirect targeting. One method has been the use of appealing flavors, prompting the FDA to ban most flavored vape liquids in the U.S., NEJM ed. 2019, 380, 679. A study published in Pediatrics, 2017, 139.2, examined teen smoking rates in the U.S. from 2004 to 2014. While the overall smoking rate dropped from 15.8% to 6.4%, there was a slight increase in combined cigarette and e-cigarette use from 11.4% to 12.2% between 2011 and 2014. Alarmingly, the study found that teens not at high risk for traditional tobacco use were starting with e-cigarettes and were more likely to smoke traditional cigarettes a year later. This underscores the importance of strict regulations on e-cigarette marketing. Promoting them as lifestyle products, especially to younger audiences, could have long-term negative consequences, despite the message that they are a safer alternative for current smokers. Key takeaways on smoking and e-cigarettes. E-cigarettes. As a quitting aid, e-cigarettes have proven useful for quitting smoking, with 80% of users continuing to vape compared to the lower retention of nicotine replacement therapies, NRT users. However, other cessation aids like bupropion and varenicline are also effective without ongoing use. Safety concerns. While e-cigarettes are likely safer than traditional cigarettes, the claim that they are 95% safer has been challenged. There are still concerns about their long-term safety. E-valley, a recognized risk. E-valley, or e-cigarette and vaping-associated lung injury, is a known risk. Healthcare providers should regularly ask about vaping in cases of respiratory distress and report any related incidents through the yellow card scheme. Effective consultations. Short interventions during consultations can be a powerful catalyst for quitting smoking. Training for medical practitioners through NCSCT can help facilitate these important conversations. In summary, while e-cigarettes may offer a safer alternative to traditional smoking, the need for long-term safety data, regulation of youth-targeted marketing, and awareness of associated risks like E-valley are crucial for informed decision-making. Quitting smoking, a quick guide, identifying smokers with very brief advice. It takes just 30 seconds to identify smokers using the very brief advice method. For training, visit the recommended resources. Ask. Start the conversation by asking about smoking habits. For example, I see from your records you're a smoker. How's that going? Advise. Inform them that the best approach combines drug treatment with support. Assist. If the patient is interested in quitting, recommend a local smoking cessation clinic, practice nurse, or schedule follow-up appointments. Assessing nicotine. Dependence. Ask these 3 simple questions to determine nicotine dependence. Time to first cigarette. Smoking within 30 minutes of waking up suggests dependence, and within 5 minutes indicates severe dependence. Daily cigarette use, smoking 10 or more cigarettes daily suggests dependence. Past quitting attempts. Ask about withdrawal symptoms or cravings during previous attempts to quit. Treatment. Approaches psychotherapy and behavioral therapy individual and group programs, as well as phone, text, and online interventions, have proven highly effective. Pharmacological. Therapy. Nicotine Replacement Therapy, NRT. Available in short-acting, gum, inhalator, sprays, lozenges, and long-acting patches forms. Suitable for all populations, including adolescents and pregnant women. Recommended usage is for at least 8 weeks, and starting before the planned quit date may improve success rates. Combination. NRT can help if withdrawal symptoms persist. Possible side effects include mild headaches, dizziness, nausea, and skin irritation from patches. Varenicline, Champix. Suitable for adult smokers, especially those with chronic conditions. Not recommended for children or pregnant women. Begin treatment 1-2 weeks before quitting, starting with a low dose and gradually increasing. Follow-up treatment for 12 weeks may reduce relapse. Common side effect, mild nausea. Bupropion, Zyban. Suitable for adult smokers with chronic illnesses. Not for use in pregnant women, those with a history of seizures, or those taking monoamine oxidase inhibitors. Start treatment 1 to 2 weeks before quitting. Possible side effects include mild nausea and a need for caution with medications that lower the seizure threshold. Key points for patients encourage the use of support networks and follow-up appointments. For those experiencing withdrawal symptoms, consider combining treatments like NRT with bupropion or varenicline. Highlight the importance of adhering to the treatment plan and addressing any side effects or concerns with a healthcare provider. In conclusion, while e-cigarettes may offer a safer alternative to traditional smoking, they are not without risks, particularly for young people and those using them alongside traditional cigarettes. The journey to quitting smoking is unique for everyone, and the combination of behavioral support and appropriate pharmacological treatments can significantly improve success rates. Remember, quitting smoking is one of the best decisions you can make for your health. Whether through NRT, medications like varenicline or bupropion, or other supportive measures, there are many tools available to help you on your path to becoming smoke-free. Stay informed, seek support, and take that first step toward a healthier, smoke-free life. Thank you for watching, and don't forget to like, share, and subscribe for more insights on health and lifestyle. See you in the next video.